name is Kayla Buckles. I'm going to be performing a musculoskeletal assessment. So first, I'm going to just do it on myself. I'm going to knock, knock, hand hygiene. Hi, my name is Kayla Buckles. I'm going to be your student nurse today. I'm going to be performing a musculoskeletal assessment on you. Would that be all right? Okay, perfect. Can you please verify your name and date of birth for me? Yes, Kayla Buckles, 1/10/96. Okay, perfect. So now I'm just going to assess your level of consciousness, orientation, and your mood. Do you know where you are today? Yes, I do. Where are you? I'm at Kayla Buckles' house in McKinney, Virginia. Okay. Do you know who the president is? Yes, I do. It's Trump. Okay. And do you, man, I forgot. Do you know what day of the week it is? It is Sunday. Yes. Okay. So the patient is alert and oriented ×3. So now I'm just going to assess your level of pain. On a 0 to 10 pain scale, 0 being no pain at all and 10 being the worst pain imaginable, what would you rate your pain today? 0? Okay. All right. So patient verifies that she is in no pain, so no pain is noted. So do you use any mobility aids such as wheelchairs, walkers, canes, or crutches? No, I don't. Okay. Do you use any medical devices such as ostomies, IVs, dressings I have to care for, SCDs, specialized mattress, or yeah, that's it. Do you use any of those? No, I do not. So the patient states and verifies she does not use any medical devices or medical equipment noted. So now I'm just going to measure vital signs. Normal blood pressure is 90/60 to 120/80. Normal heart rate is 60 to 100. Normal respirations are 12 to 20. Normal temperature is 96.8 to 100.4. And normal oxygen level oximetry is 95 to 100. Let's see. So now I'm just going to observe your gait and balance, which we're going to start with normal walking, just 6 steps forward. 1, 2, 3, 4, 5, 6. And now we're going to walk on your tippy toes back. 1, 2, 3, 4, 5, 6. And now we're going to do tandem, which is heel to toe. Almost lost my balance. All right. And now we're just going to walk back on your heels. Okay. I observed your gait and balance, and with normal walking, tandem, tiptoe, and heel walking, and it seems to me that the gait is smooth and steady and coordinate, and you walked in a straight line without losing balance. Now I'm just going to perform the Romberg test. And this is going to be a test to see if you're going to sway a lot. So I'm just going to put my hands on your shoulders and stand right in front of you with feet together. And I want you to just stand up straight and close your eyes. And I got you. And you're going to stand about this for about 20 seconds. And if you do sway, I'll stop you at any time. But I'll be putting my hands on your shoulders to stop you. Twenty seconds has passed. Okay, so it looks like the client stands with minimal swaying for at least 20 seconds. So now I'm just going to inspect the posture for symmetry and body alignment. So I'm going to observe your spine from your lateral and posterior views. And I'm going to have you bend over to where I can feel for scoliosis. And I'm just palpating the spine to observe that. And I'm also palpating for any type of tenderness. Do you have any tenderness at this time? No? Okay. All right, so the client stands with head erect, with both shoulders and hips are equal bilaterally. No scoliosis is noted, which is a lateral curvature in the spine. No tenderness is noted. So now I'm just going to inspect and palpate the extremities for color, hydration, scars, lesions, rashes, bruises, or IV sites. So I'm just gonna Feel any tenderness? No. And we're just looking for anything that's abnormal. And we'll do the same. You'll want to do same bilaterally. All right, so I inspected for color, color, hydration, scars, lesions, rashes, anything that's abnormal, bruises, IV dressings, IV sites, and everything seems to be normal. So now I'm just going to palpate all muscle groups for skin, for the size, symmetry, and of course the tone. I feel like I just did this. Normal color for ethnicity, skin was warm and dry, no scars, lesions, rashes, bruises. Muscles are firm, smooth, and symmetric bilaterally. So now I'm just going to assess the muscle strength of hands, biceps, triceps, legs, and ankles. All right, so I'm just going to put your hands against me and push forward, okay? And I'm going to push back, okay? And push forward for me, push back, push forward, push back, bend up, bend down, push forward, push back, push up, push down. All right, and I did that to both sides, so all muscles are strong, equal, bilaterally. So now I'm just going to test the range of motion. I'm going to be asking the client to move all the following joints for the range of motion. So we're going to do shoulder. You don't want to go backwards. We're going to do our wrist, our elbow, stretch out, up, hyperextend. Ooh, y'all heard that. So now I'm just going to bend up. And go up, back, and you'll do the same. Back, okay. And yeah, we're gonna do knee, up, down, side, back, up, down, side, back, and we're gonna do ankles. Dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. You're just going to roll the wrist. Roll your ankles. The same way that you did your wrist. Okay. It looks like a patient has a full range of motion in all joints. No swelling, no tenderness, no cramps noted. And we're going to do subnation. This is subnation. Pronation, sub-pro, sub-pro, subnation, pronation, subnation, pronation. Plantar flexion, stamp. Dorsiflexion is when up, plantar, dorsiflexion, plantar, dorsiflexion. All right, so now I'm just going to palpate the radial and the radial and pedal pulses. So I'm looking for the regular rate, rhythm, seeing if the amplitude is strong. I'm going to check it in both. Now I'm going to do pedal pulses. Which we're going about right here. Sorry, I'm trying to find it. Got it. Okay. All right, perfect. All right, now just looking for hair distribution and edema, which there was no edema. I didn't see none. No swelling in these cankles. So no edema is noted. Hair distribution is normal for ethnicity and the person. Edema of the feet and ankles is sometimes seen by patients who have a lot of fluid volume, that have heart problems, peripheral vascular disease, or anything like that. And that is how you do a musculoskeletal assessment by yourself.